Have you ever brushed off a strange symptom, thinking it was just part of aging? Maybe it was an odd hiccup that would not stop, a sudden dizzy spell, or a moment where your words did not come out the way you expected. Many seniors chalk these things up to fatigue, nerves, or simply getting older. But what if I told you that these so-called harmless annoyances could actually be your brain's desperate way of warning you about a stroke that is about to happen? Here is the chilling truth. Stroke is not always announced by the classic signs most people know, like slurred speech, a drooping face, or weakness in an arm. Research from the American Stroke Association shows that as many as 43% of seniors experience odd, non-traditional symptoms in the hours or days before a major stroke. These signals are often overlooked until it is too late. And while we are talking now, dozens of older adults around the world will experience a stroke before this video even ends. That is not meant to scare you, but to wake you up. Because the sooner you recognize these unusual signals, the greater your chance of protecting your independence, your memory, and your life. In this video, I will reveal 10 strange early warning signs of stroke that most seniors do not recognize. From relentless hiccups to unexplained dizziness, from facial twitching to sudden changes in vision, we will uncover the overlooked alarms that your brain may be sounding. By the end, you will know what to watch for, what to never dismiss, and how to act fast if you or someone you love experiences them. Knowledge is power. And when it comes to stroke, early awareness can mean the difference between recovery and a lifetime of disability. Before we dive in, if you have not subscribed yet, I recommend you hit that button and turn on the bell so you never miss another health tip made just for you. If you enjoy this video, type 1 in the comments. If not, type 0 to let me know how I can make better content for you. Now let us begin. Part 1. Fast for seniors. Why time is the brain's greatest asset. When it comes to stroke, every single minute matters. You may have heard doctors repeat the phrase, time is brain. And it is not an exaggeration. Each passing minute without oxygen damages millions of brain cells, and that damage can be permanent. This is why recognizing stroke signs quickly and acting without hesitation is the difference between walking out of a hospital or living with lifelong disability. The simplest way to remember the core signs of stroke is with the word fast. Face, arms, speech, and time. For seniors, understanding fast and teaching it to family members is one of the most powerful protections you have against stroke's devastating effects. Let us start with the letter F, which stands for face. When blood flow is disrupted to the brain, one of the earliest and most obvious signs can be weakness or paralysis on one side of the face. You can test this by asking the person to smile. If one side of the face droops, if the mouth is uneven, or if one eye does not open fully, that is a red flag. It is not just cosmetic. It is a direct message from the brain that signals are not reaching the muscles properly. Seniors often dismiss facial drooping as fatigue or even a dental problem. But when it happens suddenly, especially with other symptoms, it is almost always serious. Next is A for arms. Stroke often weakens one side of the body, and arms provide a quick way to spot the imbalance. Ask the person to raise both arms and keep them there. If one arm drifts down or cannot rise at all, that is a warning that the brain's motor pathways are compromised, even if the arm eventually goes back up or the weakness seems to fade. Do not ignore it. These temporary episodes may be transient, ischemic attacks. often called mini strokes, and they are among the strongest predictors of a major stroke to come. Many elderly patients later regret dismissing a brief moment of weakness, only to suffer a larger, disabling event days later. The S stands for speech. One of the cruelest aspects of stroke is how it robs people of communication. Slurred words, garbled sentences, or the inability to understand what others are saying are all hallmark signs. Sometimes the person thinks they are speaking normally, but to listeners, it sounds confused or jumbled. In elderly women especially, this can be mistaken for fatigue, stress, or even emotional upset. But sudden speech problems are a neurological emergency, not just a passing slip of the tongue. Even if the episode resolves in minutes, it should be treated with the same urgency as a major stroke. Finally, the T stands for time. Once any of these signs appear, do not wait. Do not second guess. Do not try to drive yourself to the hospital. Call emergency services immediately. In the United States, that means dialing 911. In other countries, use the emergency number where you live. Why? Because treatment windows are short for ischemic strokes caused by clots. Clot-busting medication must be given within a few hours to be effective. For hemorrhagic strokes caused by bleeding, surgery or other interventions must be done quickly to save brain tissue. Waiting even 30 minutes can mean the difference between recovery and lifelong disability. One important point for seniors and their caregivers is that strokes can present differently in older adults, especially women. Studies show that women are more likely to have atypical symptoms such as hiccups, nausea, or sudden behavioral changes. That makes FAST even more critical. If you see facial drooping, arm weakness, or speech problems, treat it as a stroke until proven otherwise. It is better to overreact and be safe than to wait and lose precious brain cells. I recall a patient, a 75-year-old woman, who came to the emergency department after her husband noticed her smile was uneven. She insisted she was fine, just tired. But he called an ambulance anyway. Within minutes, doctors confirmed she was having an ischemic stroke because she arrived quickly. She received clot-busting medication within the critical window and walked out of the hospital days later with no disability. Her husband's quick action saved her independence. So remember FAST: face, arms, speech, time. Teach it to your children, your grandchildren, your neighbors. Put it on the refrigerator. Share it at church. Repeat it until it becomes second nature. Because when stroke strikes, hesitation costs lives. And as we will see in the next section, not all stroke warnings are this obvious. Some are strange, subtle, and easy to dismiss. If FAST covers the classic signs, then the next part will reveal the overlooked symptoms that many seniors ignore until it is too late. Part 2. The overlooked warning signs 1 to 3. When most people think of stroke, they imagine the classic FAST signs: a drooping face, a weak arm, or slurred speech. But research shows that nearly half of older adults who suffer a stroke experience unusual early warnings that fall outside this traditional picture. These overlooked signals are often brushed off as quirks of aging or minor annoyances. But in truth, they can be the body's desperate cry for help. Let us walk through 3 of the strangest and most dangerous early stroke warnings that seniors must never ignore. The first overlooked sign is persistent hiccups. On the surface, hiccups seem harmless, even silly. They usually come after eating too fast or drinking carbonated beverages, but when hiccups arrive suddenly, last for hours, and feel unusually intense, they can signal something much more serious. Medical studies show that hiccups can occur when a stroke disrupts the brainstem, the control center for breathing and reflexes. This is especially true for women, who, according to research published in Neurology, are nearly twice as likely to report hiccups as a stroke symptom compared to men. Imagine a 72-year-old man who laughs off hiccups that will not stop. He thinks it is indigestion. But in reality, his diaphragm is spasming because the nerves that control it are being starved of oxygen. If he ignores this, within hours, a major stroke may strike. The danger lies in dismissing hiccups as trivial, when in fact, they can be one of the earliest whispers of the brainstem begging for attention. If hiccups persist longer than a day, or come with chest discomfort, shortness of breath, dizziness, or facial weakness, it is time to call for emergency care. The second overlooked sign is sudden dizziness or vertigo. Many seniors already struggle with balance, so when the world suddenly spins, they often assume it is an ear infection, dehydration, or just getting older. But strokes in the cerebellum or brainstem, the regions that control balance and coordination, often begin with severe dizziness and nausea. A study published in Stroke found that nearly 20% of elderly patients presented with vertigo as their primary stroke symptom. This is why misdiagnosis is so common. Doctors sometimes treat it as a benign inner ear problem, while precious time is lost. Here is what sets stroke-related dizziness apart. It strikes suddenly, without warning. It comes with overwhelming nausea or vomiting. Walking becomes impossible without clinging to walls or furniture. Sometimes vision blurs or doubles at the same time. This is not ordinary dizziness. It is the brain sending out a red flare. One 74-year-old grandmother felt the kitchen spin while she was preparing breakfast. Her daughter recognized the severity and called 911. Doctors dissolved a clot in her cerebellum before it caused permanent damage. Today she can walk with confidence again. The lesson is clear. Sudden dizziness with nausea or imbalance is not just age catching up with you. It may be the very first sign of a stroke in progress. The third overlooked sign is numbness or tingling, especially when it affects only one side of the body. Seniors often dismiss a prickling sensation in the arm or face as poor circulation, a pinched nerve, or sleeping in the wrong position. But when numbness strikes suddenly and without cause, it is often the result of reduced blood flow in the brain. Transient ischemic attacks, or mini strokes, are notorious for causing brief episodes of numbness that fade away in minutes. Yet, 1 in 3 of these cases is followed by a major stroke within days or weeks. Ignoring them can be catastrophic. The American Stroke Association warns that sudden one-sided numbness, even if it resolves quickly, should always be treated as an emergency. A 78-year-old veteran once noticed tingling in his left arm while reading the newspaper. He shrugged it off until the next day when his cheek went numb. That second episode sent him to the ER, where doctors found a blocked artery in his neck. They treated it immediately, reducing his risk of a disabling stroke by more than 70%. His story shows that numbness is never harmless when it appears suddenly and on one side of the body. Persistent hiccups, sudden dizziness, and one-sided numbness are 3 unusual but critical early warnings of stroke. Each of them can be brushed aside as fatigue, stress, or aging. Yet each of them can also be the body's last chance to cry out for help before a major event occurs. For seniors, the key is to listen to these whispers. If hiccups do not stop, if dizziness is overwhelming, if numbness appears out of nowhere, do not wait and do not assume. Call for help immediately. Because when it comes to stroke, early action is the difference between recovery and disability. Part 3. The overlooked warning signs 4 to 6. The fourth overlooked sign is sudden double vision or other dramatic visual changes. Many seniors expect eyesight to decline gradually as they age. They blame blurry vision on needing stronger glasses, cataracts, or fatigue. But stroke-related vision changes do not creep in slowly. They appear suddenly, sometimes in the middle of driving or reading, and they can be terrifying. Imagine a 76-year-old retired schoolteacher on her way to meet friends. At the stoplight, she sees 2 traffic signals instead of 1. The cars on the road appear doubled. She pulls over thinking she is just tired. But within an hour, her vision clears. A week later, it happens again with a splitting headache. At the hospital, doctors confirm she had suffered a small stroke in the brainstem, the area that controls eye movements. Research published in the Journal of Stroke and Cerebrovascular Diseases shows that up to 10% of stroke patients present first with sudden visual disturbances. Unlike age-related issues, these problems come out of nowhere. Double vision, partial vision loss, or overlapping images can appear even if your eyes are otherwise healthy. The cause is interruption of blood flow to the cranial nerves that guide eye muscles. When those muscles stop coordinating, the brain receives 2 conflicting images. Seniors should never ignore sudden double vision, even if it resolves quickly. Warning signs include eyes that refuse to focus, overlapping words while reading, or vision changes paired with dizziness, headache, or slurred speech. For many, these are the earliest alarms that circulation to the brain is compromised. Acting quickly means doctors can use clot-busting treatment before permanent blindness or disability sets in. The fifth overlooked sign is unexplained cold sweats. Most people associate clammy skin with heart attacks, not strokes. Yet both the heart and brain rely on steady blood flow, and when circulation is disrupted, the body often responds with a fight or flight reaction. Imagine a 79-year-old veteran sitting calmly in his recliner. Out of nowhere, his shirt dampens with sweat. The room is cool. He is not exercising, and he feels weak and pale. Within minutes, he is shivering and confused. His daughter notices slurred words and calls for help. Doctors confirm he is in the early stages of a stroke. Studies in the Journal of Neurology reveal that nearly 15% of stroke patients report unexplained sweating or chills in the hours before their event. The danger lies in dismissal. Seniors often think sweating is caused by anxiety, low blood sugar, or simply room temperature. But when sweat appears without reason and is paired with dizziness, weakness, or slurred speech, it can be a subtle but deadly red flag. What sets stroke-related sweats apart is their suddenness. The skin feels clammy, the body feels drained, and often other symptoms follow quickly. In elderly patients, especially those with high blood pressure or diabetes, this should never be ignored. Calling for emergency care right away can mean treatment within the golden window, often preventing lasting disability. The sixth overlooked sign is stiff neck or shoulder pain. Seniors know arthritis and poor sleep can cause stiffness. So, when discomfort shows up in the morning, many dismiss it as routine. But stroke-related pain is different. It often starts suddenly, feels deeper than muscle tightness, and worsens rather than improving with stretching or massage. Picture a 75-year-old widow who wakes up with sharp pain at the base of her neck radiating into her shoulders. She assumes she slept wrong, but by evening, the pain climbs into her head and she feels lightheaded. At the ER, doctors discover a clot near the vertebral artery, one of the major vessels feeding the brainstem. Research published in Stroke in 2018 found that seniors presenting with unexplained neck or shoulder pain were significantly more likely to later be diagnosed with vertebral artery dissection or stroke, particularly when paired with dizziness or headache. Why does this happen? The arteries along the spine supply blood to critical brain areas. If one is blocked or inflamed, discomfort in the neck or shoulders may be the first sign. What makes it dangerous is its deceptive familiarity. Seniors already expect aches, so they ignore them. But when stiffness comes suddenly, does not improve with usual remedies, or pairs with other neurological symptoms, it should be seen as urgent. For the widow, her son's insistence on medical attention saved her from a devastating event. Double vision, cold sweats, and stiff neck or shoulder pain are three overlooked symptoms that too often slip under the radar. Each one masquerades as something ordinary, from bad eyesight to arthritis to simple nerves, but each may hide an emergency unfolding inside the brain. The takeaway for seniors is simple. Pay attention to changes that feel unusual and sudden and intense. Your body does not send these messages by accident. If you notice them, seek emergency care immediately. The difference between brushing it off and acting quickly may be the difference between living independently and living with permanent disability. Part 4. The overlooked warning signs, 7 to 9. The seventh overlooked sign is excessive yawning. Something so ordinary that almost no one would imagine it could be linked to stroke. Everyone yawns when tired, bored, or after a long day. But pathological yawning is different. Imagine a 73-year-old retired bus driver sitting proudly at his granddaughter's piano recital. The music is lovely. The room is calm. But he starts yawning again and again, more than 20 times in less than an hour. He is not sleepy, and he certainly is not bored. Later that evening, weakness spreads down his left side, and at the hospital, doctors confirm the early stages of a brainstem stroke. Why does yawning matter? Research published in European Neurology shows that excessive yawning can be an overlooked neurological red flag, especially when linked to ischemia in the brainstem. Stroke disrupts the brain's regulation of temperature and oxygen, and the body may respond by triggering uncontrollable yawns in an attempt to cool or stabilize itself. Seniors should watch for yawning that appears suddenly, continues for several minutes, and cannot be controlled even when well rested. Warning signs include yawns that interrupt conversations, yawning paired with weakness or slurred speech, and yawning that feels compulsive, unlike normal fatigue. This is the body's urgent signal that circulation is being disrupted for seniors at risk. Ignoring it could mean missing a narrow window for treatment. The eighth overlooked sign is facial twitching, often dismissed as stress, fatigue, or too much coffee. A 77-year-old grandmother in North Carolina noticed her eyelid fluttering uncontrollably for weeks. At first, she laughed it off, joking that it was nerves. But one morning, the twitch spread to her cheek and mouth, leaving her smile uneven and her speech slightly slurred. Alarmed, her daughter rushed her to the hospital, where doctors diagnosed a small stroke affecting the cranial nerves on one side of her brain. Facial twitching occurs when nerves misfire, often because oxygen supply is compromised. While most minor twitches are harmless, persistent or spreading twitching can be an early neurological sign of something serious. Research in stroke and cerebrovascular diseases found that seniors with unexplained hemifacial spasms had a higher risk of vascular events, including strokes, within a year. The red flags include twitching that recurs over days or weeks, twitching that spreads beyond one eyelid, and twitching that pairs with slurred speech or drooping on one side. Seniors should treat these symptoms seriously. For the grandmother, clot-busting treatment prevented lasting disability. The key lesson is that while a twitching eyelid may look trivial, facial twitching with additional neurological changes is the body whispering for urgent care. The 9th overlooked sign is sudden facial flushing or burst blood vessels in the eye. Consider an 80-year-old retired postman whose wife notices his face turning bright red while he sits calmly in his recliner. Later that evening, a small patch of blood appears on the white surface of his eye. He thinks it is nothing, perhaps from coughing, but the next morning weakness spreads down his arm. Doctors confirm a stroke. Why would redness in the face or burst eye vessels matter? Sudden facial flushing and subconjunctival hemorrhage can signal dangerous spikes in blood pressure. Hypertension is one of the strongest risk factors for stroke. And when vessels in the face or eyes show strain, it may indicate that vessels deeper in the brain are at breaking point. A 2021 study in hypertension research found that seniors with frequent unexplained flushing had twice the risk of stroke over 5 years. Warning signs include redness appearing without heat or exertion, small blood patches recurring in the eye, and flushing paired with dizziness, numbness, or slurred speech. For the retired postman, early intervention to control his blood pressure and dissolve a clot prevented more serious damage. His story is a reminder that sometimes the smallest external changes are clues to internal crises. Yawning too much, twitching in the face, and sudden redness may not sound like emergencies. Yet, for seniors, they can be subtle alarms of a brain crying out for oxygen. The danger is their familiarity. Yawning seems normal, twitching seems trivial, and redness seems cosmetic. But each may hide a deeper threat. The body often whispers before it screams. And seniors who listen to these whispers can save themselves from devastating outcomes. Acting quickly on these overlooked signs can be the difference between a short hospital visit and a lifetime of disability. Part 5. The overlooked warning sign, 10, and a daily prevention habit. The 10th overlooked sign of stroke is sudden tremors or seizure-like activity. Imagine a 79-year-old retired mechanic in Ohio sitting quietly with a cup of tea. Without warning, his hand begins trembling so violently that the cup slips and spills. Minutes later, the shaking stops and he feels normal again. A few days later, his arm jerks involuntarily, almost like a small seizure. His family assumes it is Parkinson's or nerves, but doctors soon reveal that he has experienced multiple mini-strokes, disrupting the brain's electrical signals. Stroke does not only affect blood flow, it interferes with how the brain communicates with muscles. When brain cells in motor regions are deprived of oxygen, signals misfire, resulting in tremors, spasms, or seizure-like events. Unlike Parkinson's disease, which develops gradually, stroke-related tremors appear suddenly, unpredictably, and often in seniors with no prior history of shaking. Research in epilepsy and behavior found that nearly 8% of stroke patients experience seizure-like symptoms in the days surrounding their event. The risk is that seniors may dismiss these episodes as anxiety or fatigue. Warning signs to watch include shaking or jerking that comes on suddenly and cannot be controlled, trembling that starts and stops without clear reason, and spasms paired with other stroke indicators such as dizziness, numbness, or slurred speech. For the retired mechanic, recognizing the connection and seeking help prevented a larger disabling stroke. With medication and therapy, he regained stability and now restores old cars with his grandson. The lesson is clear. Tremors or seizures in seniors should never be dismissed as harmless aging. They may be the brain's final alarm before catastrophe. After exploring 10 overlooked warning signs, it is important to share one simple yet powerful daily prevention habit. That habit is morning hydration with a glass of warm water. Many seniors wake up dehydrated after hours of sleep. Their blood thicker and more prone to clotting. This is one reason strokes occur most often between 4 and 8 in the morning. A 72-year-old grandmother in Kansas used to skip water and head straight for coffee. She often felt groggy, stiff, and headachy. After her doctor suggested drinking a glass of warm water upon waking, she noticed her blood pressure improved. Her headaches eased, and she felt steadier. Why does this work overnight? The body loses water through breathing and sweating. Rehydrating first thing thins the blood, improves circulation, and reduces stress on arteries. A study in the Journal of Stroke and Cerebrovascular Diseases found that well-hydrated seniors were 30% less likely to suffer a stroke compared to those chronically dehydrated. The benefits go beyond clot prevention. Hydration supports kidney function, digestion, and brain clarity. Warm water in particular relaxes blood vessels, making circulation smoother and gentler on the body. Seniors can adopt this habit easily. Keep a glass by the bed. Drink before coffee or breakfast. Choose warm or room temperature water rather than cold. Aim for 8 to 12 ounces. Enough to rehydrate without overwhelming the bladder. This small ritual is simple, free, and profoundly protective. That Kansas grandmother now calls her morning glass of water her liquid life insurance and encourages friends to do the same. By combining awareness of unusual symptoms like tremors with simple prevention habits like morning hydration, seniors can dramatically reduce their risk of stroke. Knowledge is power, but action is protection. Each choice, each sip of water, each call to 911 when a strange symptom appears is a step towards safeguarding independence, memory, and life itself. Doctor's final words. After walking through 10 overlooked signs of stroke and the habits that can help prevent them, I want to leave you with a message that goes beyond science. Stroke is not just a medical event. It is a life event. It has the power to change how you walk, how you speak, how you think, and how you connect with the people you love. But it does not have to take away your future. Too many seniors believe that decline is inevitable. That weakness, confusion, or loss of independence is simply the price of aging. That is not true. What steals independence more often than age is silence. It is ignoring the whispers of the body until they turn into screams. The truth is, your body always speaks. A hiccup that will not stop, a dizzy spell that feels different, a twitch that keeps coming back, a sweat that feels out of place, a stiff neck that does not respond to rest, or a tremor that suddenly takes control. These are not random annoyances. They are coded messages. They are the body's way of saying blood flow is in danger. Brain cells are starving. Act now. Every story we shared today proves one thing. Early recognition saves lives. George with his persistent hiccups, Mary with her spinning kitchen, Robert with his tingling arm, Linda with her doubled vision, James with his cold sweats, Margaret with her stiff neck, Harold with his endless yawning, Eleanor with her twitching eyelid, Walter with his sudden facial flushing, Charles with his unexplained tremors. Each of them could have dismissed their symptoms, but quick action turned possible tragedy into survival. Each case reminds us that when it comes to stroke, minutes matter more than years. Prevention is powerful too. Something as simple as drinking warm water in the morning, taking daily walks, eating balanced meals, or practicing calm breathing can strengthen your body's defenses. You do not need expensive gadgets or complicated programs. What you need is awareness, consistency, and the courage to listen to yourself. Knowledge without action is wasted, but knowledge with action is life-saving. So here is my plea. Do not wait until tomorrow. Do not wait until the next strange symptom. Share what you learned today with your spouse, your children, your friends at church, or your walking group. Teach them the FAST method. Face, arms, speech, time. Teach them that unusual signs like hiccups or yawning may matter just as much as slurred speech. Remind them that calling 911 quickly is never an overreaction. It is the smartest decision you can make when the brain is at risk. I want you to remember this. Your best years are not behind you. They are still ahead. If you choose them, you still have time to protect your independence, your memory, and your dignity. You still have time to walk longer with your grandchildren, to laugh with friends, to live life on your own terms. Stroke does not have to end those dreams, but ignoring the signs just might. So listen closely, respect your body, act quickly, and never underestimate the power of small daily choices. Because those choices, repeated day after day, build a shield of protection around your brain and your future. Your body remembers how to heal. Give it the chance. Now, I would love to hear from you. Take a moment to reflect and share one thing you have learned and plan to apply in your own life. Let us support each other on this journey toward embracing these truths. If you enjoyed this video, comment 1. If not, comment 0. Do not forget to like, share, and subscribe so that together we can spread knowledge that saves lives. Thank you for watching. And here is to living strong, living wise, and living free.